In 1940, nearly half of all American homes lacked indoor plumbing. There were no flushing toilets, no bathtubs, and no running water from a faucet. The United States was still 2 decades away from putting a man into space, yet nearly 40 million Americans were hauling water by hand every single day. To understand how one of the world's wealthiest nations remained so primitive for so long, the story begins at a modest farmhouse in North Carolina, and with a woman who would walk farther than most people will ever drive. In 1892, a young woman in rural North Carolina married a farmer and moved into a small wooden house on his land. The home had no plumbing. A natural spring sat about 60 yards away, and for the next 4 decades, that spring became the center of her daily existence. Every day, without exception, she walked to the spring, filled her buckets, and carried them back home. On an ordinary day, she made the journey 6 times, 6 trips there and 6 trips back, hauling water for cooking, cleaning, bathing, and caring for the animals. During laundry days and harvest season, she made even more trips. Over the course of 41 years of marriage, she walked more than 6,000 miles simply to bring water into her own home. That is roughly the distance from the Atlantic coast to the Pacific coast and back again. She was far from unusual. Across rural America, nearly half of all families were still living without indoor plumbing well into the middle of the 20th century. In most households, the burden of hauling water fell to women and children. Men worked the fields, women worked the water. Historians estimate that in homes without plumbing, simply retrieving water consumed 6 to 8 hours every week. Not every month, every week. That meant sacrificing an entire working day every single week just to bring enough water into the house to survive. The tools were simple: wooden buckets, tin pails, and sometimes a shoulder yoke that balanced 2 buckets at once, much like those seen in old photographs from rural Appalachia and the Deep South. Every drop of water was precious, because every drop came at a cost measured in sweat, time, aching shoulders, and daylight that could have been spent doing something else. But an even greater danger was about to emerge. For most of that history, nobody realized that the water they hauled, boiled, drank, and bathed in was already killing them, slowly, silently, and in ways no one yet understood. For the first 2 centuries of American history, water came from only 3 sources. Families either dug a well, often 20 to 100 feet deep, through hand-shoveled earth lined with stone or timber to prevent collapse, collected rainwater in barrels beneath their rooftops, or carried water home from the nearest stream, spring, or pond. Those were the only options. Colonial towns attempted to organize public water supplies, but the systems were extremely primitive. In 1652, Boston built what is often considered America's first municipal water system, a network of hollowed-out wooden logs joined end-to-end and buried underground. The system was designed primarily to supply water for fighting fires. It was never intended for drinking or bathing. Cities built these early systems because they kept burning down, not because they understood the importance of clean drinking water. Even when those wooden pipelines functioned, the water flowing through them was anything but clean. Nobody tested it. Nobody filtered it. The scientific concept of water contamination simply did not exist. If the water looked clear and did not smell terrible, people drank it. If it smelled bad, many drank it anyway because they had no alternative. That lack of understanding would soon cost thousands of lives. In the summer of 1832, cholera reached New York City. The disease had originated in South Asia, spread across Europe, crossed the Atlantic aboard immigrant ships from Ireland, passed through the port of Montreal, and eventually traveled down the Hudson River into Lower Manhattan. Within weeks, New York was in the grip of a devastating epidemic. The disease struck working-class neighborhoods first and hardest. The 6th Ward, home to the infamous 5-Point slum, became the center of the outbreak. Families packed into crowded tenement buildings relied on shallow wells, while nearby privies and garbage pits leaked raw sewage into the groundwater. Cholera killed with terrifying speed. A person could be healthy at breakfast and dead before nightfall. Its symptoms were horrifying: relentless diarrhea, uncontrollable vomiting, extreme dehydration, and skin that gradually turned bluish from the loss of fluids. In their final hours, victims begged desperately for water, consumed by an unbearable thirst that nothing could satisfy. The cruel irony was that the very water they pleaded for was often the thing that was killing them. By the time the epidemic subsided that summer, approximately 3,500 New Yorkers had died out of a population of roughly 250,000. Scaled to the size of modern New York City, that would be equivalent to around 100,000 deaths in a single season. The tragedy was compounded by one devastating fact: nobody understood why it was happening. Germ theory had not yet been developed. Louis Pasteur would not establish the connection between bacteria and disease until 1860, and John Snow would not trace London's cholera outbreak to a contaminated water pump until 1854. In 1832, the dominant medical explanation was the theory of miasma, the belief that disease spread through foul air rising from swamps, garbage, and decay. If you could smell it, people believed it could kill you. That was considered sound science. Rather than fixing the city's contaminated water supply, New York's leaders blamed the victims themselves. City officials and Protestant church leaders publicly declared that cholera was God's punishment for wickedness and immorality. According to their reasoning, the poor were dying because they deserved it. Immigrants, alcoholics, and anyone considered morally weak were supposedly being judged by divine punishment. The mountains of garbage and overflowing privies lining the streets, filth so notorious it earned the nickname Corporation Pudding, were viewed not as a public health disaster, but as evidence of the residents' own character. People were dying because their drinking water was contaminated with sewage, yet the city's official response insisted the victims had brought the tragedy upon themselves. However, the epidemic accomplished something decades of suffering never had. It frightened the wealthy. Cholera did not remain confined to the slums. Gradually, it spread uptown, reaching merchants, property owners, and politically connected families. Almost overnight, the idea of constructing a clean municipal water supply stopped being viewed as an act of charity and became an urgent matter of self-preservation for those who held power. Just 2 years after the epidemic, New York City voters approved plans for an entirely new water system. The answer had been sitting 41 miles north of the city all along. Building it, however, would require one of the most ambitious engineering projects the young United States had ever attempted. Philadelphia had actually taken the first major step. In 1815, it became the first city in the United States to establish a government-operated water supply for its residents. The Fairmount Waterworks drew water from the Schuylkill River using steam-powered pumps, forced it through cast-iron pipes, and distributed it to homes and public hydrants throughout the city. The true breakthrough was cast iron. For decades, American cities had relied on hollowed-out wooden logs, the same crude technology first introduced during the 1600s. Wood rotted, leaked, and could not withstand high water pressure. Philadelphia became the first city in the world to replace its entire municipal water system with cast iron pipes, setting a new standard that cities across the country soon began to follow. Yet it was New York's project that transformed the national conversation. Construction began in 1837 under Chief Engineer John Jervis. The goal was simple in concept, but extraordinary in execution. Transport clean water from the Croton River in Westchester County, located 41 miles north of Manhattan. The project employed between 3,000 and 4,000 workers, most of them Irish immigrants, earning about $1 a day. They blasted through solid rock, carved tunnels beneath hillsides, crossed valleys and streams, and built an enormous elliptical aqueduct lined with brick masonry. Measuring 8.5 feet high and 7.5 feet wide, the structure descended at an incredibly gentle grade of just 13 inches per mile. The entire system relied solely on gravity. There were no pumps, no engines, Just the steady pull of the earth, carrying water from the countryside into the heart of New York City. On the morning of June 22, 1842, John Jervis gave the order to release water from the Croton Dam. Gravity took approximately 22 hours to carry the water the full 41 miles into Manhattan. To commemorate the achievement, 4 engineers climbed into a small wooden boat known as the Croton Maid and floated through the aqueduct itself, drifting silently through the dark brick tunnel at roughly 2 miles per hour until they reached the Harlem River. The official celebration followed on October 14th. Nearly 250,000 people crowded Broadway for what was then the largest parade in New York City's history. The procession stretched from the Battery to Union Square before continuing to City Hall Park, where a brand new cast-iron fountain sent Croton water soaring 50 feet into the air. Spectators were served what became known as Croton cocktails, nothing more than water mixed with lemonade. They raised their glasses of clean drinking water and celebrated as though they had witnessed a miracle. For a city that had buried 3,500 cholera victims just 10 years earlier, it truly felt like one. Within only a few years, wealthy neighborhoods throughout Manhattan had indoor plumbing connected directly to their homes. Bathtubs became increasingly common. Hot water became possible through coiled metal pipes attached to coal-burning stoves. Public bathing houses opened to serve residents who still lacked plumbing in their own homes. By 1844, more than 6,000 homes had been connected to the Croton system, and New York's rates of waterborne disease had already begun to decline. Other cities quickly followed. Boston, Baltimore, Detroit, and St. Louis each launched major municipal water projects over the following decades. But beneath this remarkable progress lay a far less encouraging reality. The same infrastructure transforming life in America's growing cities was almost entirely absent from the places where most Americans actually lived. By 1900, only about half of the US population had access to any form of public water supply, and the overwhelming majority of those people lived in urban areas. Rural America, where most Americans still resided at the turn of the century, had seen little change. Families throughout the Midwest, the Deep South, Appalachia, and the Great Plains continued relying on the same methods their grandparents had used. Hand-dug wells, buckets carried from springs and creeks, rain barrels, and outdoor privies instead of indoor toilets. Even within cities, access to water reflected deep social inequality. Affluent neighborhoods in New York, Boston, and Philadelphia had enjoyed complete indoor plumbing by the 1870s. Only a few blocks away, working-class tenement buildings often forced dozens of families to share a single faucet in a hallway. In some buildings, the only available water came from a hand pump located outside in the courtyard, exposed to every season of the year. The divide between rich and poor was no longer measured only by income or education. It was measured by whether your children had clean water to drink. The reason this inequality persisted was no mystery. It came down to money. Installing water pipelines across flat farmland was expensive enough. Extending them through the Rocky Mountains of Appalachia, the swamps of the Mississippi Delta, or the vast, isolated stretches of the Great Plains was exponentially more costly. The expense for each household was enormous compared to the densely packed infrastructure of an urban city block. No one was willing to pay the price. Not state governments, not county governments, and certainly not struggling farmers, many of whom were barely surviving themselves. As a result, the divide continued to grow. America's cities became cleaner and healthier. Rural America remained trapped in the past. For decades, the federal government did little to change that reality. Eventually, that would begin to change, but not for the reasons most people would expect. By 1935, the federal government had finally acknowledged the growing disparity. Yet, Franklin Roosevelt's New Deal was never intended primarily as a public health initiative. It was designed as a massive employment program. The fact that it revolutionized access to clean water across rural America was, in many ways, an unintended consequence. The Public Works Administration financed the construction of waterworks, sewage systems, and municipal water mains in communities across the nation. The Works Progress Administration built or improved hundreds of thousands of miles of roads while also constructing schools, hospitals, and essential public utilities. Even so, most of that funding flowed toward towns that already possessed some level of political organization, communities capable of submitting grant applications and managing large construction projects. The most isolated and impoverished families often remained the last to receive help. The Farm Security Administration pursued a different strategy. Established in 1937, it provided low-interest loans directly to struggling rural families. Many of those loans funded basic improvements such as private wells and indoor plumbing. Meanwhile, the Tennessee Valley Authority transformed one of America's poorest regions by building dams, expanding electrical service, and developing water infrastructure across 7 states. The Rural Electrification Administration focused primarily on bringing electricity to remote communities, but it also demonstrated how the federal government could extend essential services through locally organized cooperatives. Electricity made water pumps possible. Water pumps eliminated the need to haul heavy buckets by hand. For countless rural families, that single technological change transformed everyday life forever. Even with this unprecedented federal investment, progress remained painfully slow. During the 1930s, the Farm Security Administration dispatched photographers across rural America to document living conditions. What they captured was astonishing. Families drew drinking water from muddy ditches. Children drank from streams shared with livestock. Barefoot women carried heavy buckets across soaked fields. These were not photographs from the 1800s. They were taken during the 1930s in the wealthiest nation on Earth. By 1940, the US Census asked Americans about indoor plumbing for the very first time. The results were startling. Nearly 45% of all homes in the United States reported having no complete plumbing facilities. In 10 states, the situation was even worse, with rates approaching or even exceeding 70%. These were not isolated frontier territories. They were states home to millions of people. It would ultimately take a world war and a former potato field on Long Island to finally break the pattern. World War II transformed the American home more rapidly than any government policy or engineering project of the previous century. As the war ended, factories that had once produced tanks and bombers converted their assembly lines for peacetime manufacturing. Construction companies that had built military barracks shifted their focus to residential housing. At the same time, millions of returning soldiers, supported by GI Bill mortgages that required little or no down payment, began searching for homes where they could build new lives with their families. What many of them found was Levittown. In 1947, the construction company Levitt & Sons broke ground on a former potato field in Nassau County, Long Island, launching one of the most influential housing developments in American history. The pace of construction was unlike anything the country had ever witnessed. A new house was completed every 16 minutes. Each home required 36 workers, organized into 27 specialized construction steps, with every crew performing the same task repeatedly, much like workers on a factory assembly line. The first Levittown homes sold for $7,900. Within just a few years, more than 17,000 houses stood where potatoes had once grown, creating a community of approximately 84,000 residents. Every one of those homes came equipped with a kitchen sink, a bathroom, hot and cold running water, and a flush toilet. Indoor plumbing was no longer considered a luxury. It had become a standard feature, built directly into the home before its first occupants ever moved in. For families who had spent generations hauling water from wells or sharing a single cold water faucet in a crowded tenement hallway, simply turning a handle and watching hot water pour into a porcelain bathtub felt almost unimaginable. It represented far more than convenience. Laundry that had once consumed an entire day of boiling water and scrubbing clothes could now be finished in just a few hours. Baths that previously required a dozen exhausting trips to a nearby spring could be prepared with the simple turn of a faucet. Women who had devoted years of their lives to carrying heavy buckets suddenly found themselves with hours of free time every week. Levittown was only the beginning. By the middle of the 1950s, roughly 85% of all new home construction in the United States was taking place in suburban developments. From California's San Fernando Valley to the suburbs surrounding Chicago and the expanding neighborhoods outside Atlanta, developers copied the Levitt model. Mass-produced homes, modern appliances, indoor plumbing included as a standard feature. The numbers tell the story. In 1950, approximately 1/4 of all American homes still lacked complete plumbing. By 1960, that figure had fallen to about 1 in 6. By 1990, it had dropped to less than 1%. Yet those numbers reveal another remarkable reality. In 1960, the United States was launching astronauts into space, broadcasting television coast to coast, and building an interstate highway system stretching more than 41,000 miles. At the very same time, somewhere between 10 and 15 million Americans still lived without a toilet inside their homes. The suburban housing boom had transformed life for millions, but it had left other communities behind. The places that remained without basic plumbing rarely appeared on the evening news. They were found throughout Appalachia, the rural Deep South, migrant farm worker camps in California and Texas, and Native American reservations across the American Southwest. These communities existed in a very different America, one that looked far more like 1910 than 1960. The plumbing gap was not an accident. A report published by the nonprofits Dig Deep and the U.S. Water Alliance found that race was the single strongest predictor of access to running water in the United States. Native American households were 19 times more likely than white households to lack indoor plumbing. Black and Latino families were nearly twice as likely. The infrastructure that the New Deal helped build during the 1930s, the very system that finally began narrowing the divide between cities and rural America, had never been designed to reach everyone. It marked a historic turning point. For decades afterward, it worked remarkably well. Rates of waterborne disease continued to fall. Public confidence in tap water remained high. The system functioned as intended. For nearly 70 years, Americans lived under a simple expectation. Cities would maintain their infrastructure, government agencies would monitor water quality, and families could trust the water flowing from their faucets. Then the system failed in the one place where it should have been strongest. In 2014, the city of Flint, Michigan, made what appeared to be a routine cost-cutting decision. City officials switched Flint's water supply from the Detroit water system to the Flint River. The river water, however, was significantly more corrosive than the city's previous water source. Officials failed to treat it properly before sending it through Flint's aging water infrastructure. As the untreated water flowed through old lead pipes, it corroded the metal, allowing lead to leach directly into the drinking water. Almost immediately, residents noticed something was wrong. The water looked different. It tasted different. It smelled different. Families repeatedly reported their concerns, insisting that something was contaminating their water. Officials assured them it was safe. It wasn't. By the time independent testing revealed dangerously high levels of lead contamination, thousands of children had already been exposed. For many of them, the damage, particularly to developing brains, was permanent and irreversible. The crisis became even more disturbing when internal EPA emails later surfaced. Those communications revealed that regional staff had raised serious concerns about Flint's water quality months before the disaster became public. The warnings had been minimized. In some cases, they had been ignored altogether. Flint was not an isolated village without infrastructure. It was an American city with a municipal water system, federal oversight, and every safeguard that was supposed to prevent exactly this kind of catastrophe. Yet, it happened anyway. If the system could fail in Flint, it could fail almost anywhere. Meanwhile, hundreds of miles away, another crisis had never truly ended. Across the Navajo Nation, the largest Native American reservation in the United States, spanning parts of Arizona, New Mexico, and Utah, roughly 30% of households still lack access to running water. For many families, collecting water remains part of everyday life. Some drive 45 minutes each way simply to fill containers at a windmill-powered water station. Others purchase water by the barrel because no pipes reach their homes. One retired community health worker described the daily routine in simple but heartbreaking terms. Every morning begins with the same question: where can enough water be found to make it through the day? The routine includes hauling water, hauling firewood, hauling trash, using an outhouse beneath the desert sun. This is not a passage from a history book. It is a description of life today. The consequences became painfully clear during the COVID-19 pandemic. The Navajo Nation experienced one of the highest per capita infection rates in the United States, due in part to the simple fact that many residents could not wash their hands as frequently as public health officials recommended. According to the Indian Health Service, providing basic water and sanitation infrastructure across the reservation would require an investment of approximately $200 million. In many remote locations, extending water pipelines to a single home can cost millions of dollars. That woman from rural North Carolina, the one introduced at the beginning of this story, walked more than 6,000 miles over 41 years, carrying water from a spring located just 60 yards from her home. Her house may still be standing today, and it may still depend on that very same spring. The average American now uses approximately 88 gallons of water every day. Most people turn on a faucet without giving it a second thought. They flush a toilet without wondering where the water goes. They fill a bathtub without imagining how many exhausting trips to a well that same amount of water would once have required. Nearly every aspect of modern domestic life – cooking, cleaning, bathing, sanitation, laundry, even pouring a simple glass of water for a child before bed – depends upon an immense infrastructure that remains almost completely invisible. Beneath nearly every American street lies a vast network of pipes, valves, pumps, reservoirs, and treatment facilities. Together, they represent one of the greatest public works achievements in human history. This system was not created by a single visionary. It was not built through one law or completed during one generation. It emerged over more than 2 centuries, one city at a time, one epidemic at a time, one engineering breakthrough at a time, one political battle at a time. It exists because communities suffered devastating disease outbreaks and demanded something better. Its expansion, however, was never equal. Some communities gained access to clean, running water nearly a century before others. And even today, some are still waiting. The pipes beneath America's streets are monuments that almost nobody notices. Yet, they are among the most important structures ever built. Every shower, every clean glass of drinking water, every meal that did not make someone sick. Every one of those moments traces back to a decision repeated across generations, that water should no longer have to be carried by hand. It should flow. That is the true legacy of running water in America. It belongs to the engineers who designed and built the Croton Aqueduct. It belongs to the Works Progress Administration crews who laid water lines across rural communities. It belongs to the activists who fought for the Safe Drinking Water Act. And it belongs to the families of the Navajo Nation who continue waiting for the promise of safe, reliable running water to reach their homes. Because the story of running water in America is not over. Not even close.